Hi, my name is Carmen Serban, and I'm doing this video at Lunch with the Theories for as assignment number 3 for Nursing 608 for the course Philosophical Foundations of Nursing. I'll be talking about on this video about Patricia Benner a little bit, about her theory. I'll tell you where I'll invite her for lunch. I'll tell you the 5 questions that I decided to ask her and the rationale why I'm asking those questions. And after that, I'm going to give 2 examples. One that applies her theory and one that her theory is not applicable. So first off, Patricia Benner was born in 1942. She's a highly educated nurse. Patricia obtained her PhD in 1982 at California. At the University of California. She wrote many books and published many articles, but she's mostly known for her theory, novice to expert. Benner introduced the concept that expert nurses develop skills and understand patient care over time through education and practical experiences. Benner said that the nurse could gain knowledge and skills through experience. In 1982, Benner published Novice to Expert Theory. The theory states that nurses pass 5 stages of development from novice, advanced beginner, competent, proficient to expert. Each level builds on the other to promote growth and independence. For Patricia Benner, practice is the way of knowing. I will describe each one of the 5 stages of development. The novice nurse needs step-by-step instructions. Are the new grads and they lack confidence, has no experience, and is not efficient usually. Behavior and knowledge are limited and inflexible. Limited ability to predict outcome in an acute situation. The advanced beginners nurses are guided by rules that demonstrate acceptable practice. Their experience will help them develop principles to improve nursing practice. They are task-oriented and they have basic knowledge. Competent nurses can prioritize and follow a care plan for the patient, has few years of experience. A competent nurse can recognize patterns from previous experiences, gains a clear perspective in making conscious decisions while incorporating analytical thinking. The competent nurse is organized and efficient. Proficient nurse has a holistic understanding of the patient, uses experience when approaching patients. A proficient nurse learns what to expect in certain situations, is able to modify plan, is adaptable, and uses critical thinking. And the expert nurse has an intuitive grasp on each situation based on experience. Fluid in practice, does not respect rule, is guided by experience and critical thinking. And now I'll tell you where I'll invite her for lunch. For the purpose of this video, I am Carmen Serban, the manager of the emergency department at Eagle Ridge Hospital. And I'm inviting Patricia Benner in my office to have lunch with because I need her advice in how to improve the flow in the unit and how to improve patient care. First question that I would ask Patricia is, as a manager to the emergency unit, I need to monitor and ensure high quality care practices for the patients. Therefore, I want to know how I can ensure safe nursing patient care in a fast-paced environment. I'm asking this question due to shortage of nurses, high turnover, increased number of patients, increased acuity level of care, and nurses burnout. The second question I would ask Patricia is, how can we provide proper education for the nurses and support their needs in order to increase work satisfaction and decrease turnover? Our unit has a budget allocated for education. However, due to high turnover, it's a larger number of nurses that need to be trained, and the budget is still the same. So how do you manage to educate nurses properly with a limited budget? The third question that I want to ask Patricia is why some nurses do not progress through the 5 levels of competencies described by you. I am asking this question because every unit needs expert nurses. which are harder to find. Some nurses reach a level of competency and after that they are not willing to learn anymore. So they are stuck at a certain level. Why this has happened and how we can motivate them to want to become proficient and expert nurses. Question number 4, do you feel the theory you develop, it is still current and applicable to practice? I'm asking this question because the new nurses are forced to skip steps in their education when they start practicing. Nurses need years of experience to become competent nurses, but due to shortage in nursing, new grads are faced with acute situation in which they lack experience. This leads to burnout. It feels the new nurses are not given the time, support, and education to be successful. So that's why I'm asking this question. Question number 5. What are your thoughts regarding hiring new grads into emergency department? Is that safe practice? By doing that, do you really give the opportunity to the new grads to progress to the phases of development? I'm asking this question because we promote hiring new grads, and also we support students in their final preceptorship. But we have controversial opinion on the subject in the unit. So I would just want to hear your opinion on this for that reason. And question number 6, how can you retain nurses in the nursing field, especially expert nurses that are mostly needed in emergency room? I'm asking this question because I'm because in an emergency department, we cannot function without expert nurses. We need expert nurses. The fact that we have lots of novice nurses and advanced beginners and competent nurses does not provide a safe environment. In an emergency room, you need proficient and expert nurses. Okay, and now I'll talk about the theory, an example of how the theory applies, and one example where the theory does not apply. So Benner theory is used in our setting because it helps guide the education and training each nurse needs and the support required to maintain staff and feel support in their professional growth. Example of how the theory novice to expert is applicable in our department is the fact that nurses cannot work in certain areas of the unit until they are properly trained and until they have the experience they need in order to provide safe care. So, for example, beginner nurses are present in the department because we hire new grads, and we are hiring and we allow students to come for their final preceptorship. They are practicing under the guidance of a competent and a proficient nurse, so they're not practicing by themselves. Next stage is advanced beginner and competent nurses. If they start in our unit, they are starting in the med-surg side. They are not allowed to work in any of the other sides of the emergency. So they can work in RAS, or they can work in the cardiac side, or they can work in triage. So they are only working in med-surg side for 6 months to a year until they are confident. When they feel confident enough, then they would ask me to be sent to training to be cardiac trained nurses, and then they could start working in the cardiac side of the department. Once they build experience there, they can work in the trauma room. And competent and proficient nurses work in the trauma and cardiac side. To have the role of triage nurse, trauma room nurse, rapid access zone, and circulating nurse must be a proficient to expert nurse. The department limits the access to certain areas of the department made based on the experience, desire to learn, and continuing education. Critique for the theory. The theory sometimes feels idealistic. Due to the current problems we are facing, high turnover, nursing shortage, burnout, increase in the number of patients, if you work on a small hospital, nurses are pushed into practicing skills and situations that they are not comfortable with. And that's the example that I'm going to give, because the nurse is not going from beginner to advanced beginner to competent to proficient to expert. They need to jump from maybe advanced beginner to competent, or to a different level of development. So the example I'm going to give is an example. So we had a patient in the emergency department not long ago. She was pregnant. She didn't know that she's pregnant, and she was going to deliver her baby. The stress around that situation was that we were afraid that the baby is going to be a preemie. Being a small hospital, we are not prepared to handle those type of patients. But this was an emergency situation. The patient could not be transferred to a bigger hospital. Therefore, we had to handle the situation. The staff was overwhelmed with the situation. Luckily, the baby was born to term and was a healthy baby. It felt that the nurses on the floor would have not been prepared to manage safely a premature baby. There were no proficient or expert nurses on the floor to manage that patient, and there was no time for the patient to be transferred to a bigger hospital with appropriate resources. This was a big learning for the department, and proper training was provided afterwards by the nurse educator. Also, a manual was created with step-by-step instruction on what to do and where to find the necessary supplies when something similar happens again. Okay, thank you for your time. This was my video. Thanks.